Hi, welcome to the channel, and today we're going to demonstrate to you how to make a retinotomy to drain subretinal fluid in patients undergoing pars plana vitrectomy for Rhegmatogenous retinal detachment. The particular case we are dealing with had a bullous inferior retinal detachment, which you can see over here, and we're using a retinotomy endocautery to do the retinotomy over here. We'll move forward and see in the video how we proceeded with that. So you come up, the retinotomy is being done nasally, and you can see you gently touching the retina, and then you're moving forward and touching it slightly more deeply, and that will produce that whitening of the retina. And you don't want to do it too much, just needs to be enough. And I'm using cutter, 23 gauge cutter, to remove SRF and to make sure that there's no vitreous in front of that retinotomy, so that SRF completely gets removed while I'm changing over to an extrusion needle. Now I've changed over to an extrusion needle and started an air fluid exchange. As soon as the air starts to fill in from anteriorly, you can see the retina becomes bullous, and sometimes it becomes difficult to find out where the retinotomy is. So you have to be very vigilant to just keep track of the retinotomy and don't let the retinotomy fold back behind that. So as soon as you have the fluid air exchange coming to the level where the hole is, you can see the subretinal fluid starts to drain very quickly, and it tends to, so you can see I'm using active suction. The active suction can be with a syringe, or it can be attached to the vitrectomy machine, and you can be doing active suction in here. You can see there's still fluid in the vitreous cavity, or BSS, in the vitreous cavity behind the hole, but I'm trying to just get the SRF out while still in that place. So you can see the retinotomy is about 3 disc diameter nasal to the optic disc. It's in between the supranasal and infranasal blood vessels, and it is away from any blood vessel. That the reason is, if there's any blood vessel and that bleeds, then it's going to trickle down to the back, and that is the reason you do a retinotomy on the nasal side and not superiorly or inferior to the supratemporal and infratemporal vessels, because if there is subretinal hemorrhage, that is going to track over to the macula, and that is going to be toxic to the fovea as such. So you can see you're reaching till the end, and normally we would think that that's all the SRF that remains. But I think if you consider it like that, on mountains, if you've got rain and there's a lot of fluid that comes back, even then the cavity is going to have that SRF and fluid coming down posteriorly uh, till a few minutes after we removed all the SRF. So you can see I've removed the SRF, then I come back again and remove more of the SRF, and here you can see that stringy area of fluid that tells you that you're nearing the end. You can see the SRF still is trickling down, and there's some fluid over the optic disc as well. So because the next step is doing an endolaser to protect that area for not detaching after surgery. Sometimes I was not getting that good result on endolaser, so I just went wider on that. You can see the marks over there. But the reason usually is your SRF is not completely removed. So I again go back in and remove the SRF. So it takes about, I think, what I found out over time is that 3-4 minutes you have to wait for that SRF to get totally removed over in that area. So the take home message is, set the cautery to a low setting, avoid blood vessels, try to stay away from it, and stay at least 1 diameter away from this. Probably further away is further than that is much better. Clean vitreous over the retinotomy and drain partially under fluid the SRF, and then drain all of the SRF under air, and you'll need multiple attempts to do that. And complete SRF removal is necessary for laser to be effective. Sometime in peripheral breaks, if you don't think the laser is getting good reaction, you can use substitute for a cryo. But for posterior anatomy, you have to remove that SRF to get that laser working. You might need a higher setting on laser if there's some SRF over there. So the last SRF needs to be repeatedly drained for about 3 to 4 minutes. So thank you very much for watching, and I hope this has been helpful to you.